Okay, good morning. This is Miss Jenny. So, Jenny, go ahead and tell us how you did with your stem cell therapy, what you had it for, and just tell people how you've done.
I had the stem cell therapy for basically two reasons: my left hip pain that I've had for 25 years, and Hashimoto's thyroid disease that I've been having issues with. And as far as the hip pain, it was about 6 months ago that I had the stem cell infusion, and I'd say my hip pain has gone down about 80%. And the orthopedic had just suggested that a hip replacement was the only suggestion. He didn't give me any other alternative other than injections, which were not helping. So it's been very good for my overall hip pain reduction. And I also feel more energy. Definitely have more energy during the day, during the afternoon. So it's definitely helped for my thyroid problems.
So, you came in initially, you had fatigue,
Yes.
right? And the blood test showed you had Hashimoto's. So, the nurse practitioner, Lauren, she did an infusion, an IV of the stem cells,
Yes.
and that helped your fatigue. And she didn't inject the hip with the stem cells, right?
No. So it was just a total body infusion
Right,
because I wanted to get the best bang for my buck
right,
and do the whole body to see how I would react with that.
right.
And it's been a good experience.
So
for sure.
doing the infusion, those stem cells helped decrease the inflammation in the hip joint, when in fact we didn't even inject the hip joint. And we figured if it didn't help the hip, we could maybe inject the hip later on down the line. But
Right.
as it turns out, it looks like we don't have to.
Right.
Right.
I mean, it's definitely helped tremendously with my hip pain, especially with my job where I'm on my feet all the time. So I don't think I could have the job that I have now without the stem cell infusion that I had, because
Right.
it's definitely helped my pain level.
Right. So you'd recommend this for people to try it?
I would definitely recommend to try it, because if your alternative is getting a hip replacement or joint replacement, you have nothing to lose but to gain.
Right. And as I always tell patients, and the nurse practitioner, we tell patients, the worst case scenario, stem cells won't help, but they won't hurt you. Right? And there's not a lot of treatments in medicine that won't hurt you. There's quite a few treatments that can hurt. But best case scenario, patients will achieve their goals with stem cell therapy, and most people do. So would you say you achieved your goals?
Yes, I would say it has been a very pleasant surprise as to how much pain relief I have had. Definitely.
Okay. Well, thanks very much. It'll help a lot of people.
Sure thing. Thank you.